Welcome back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and hopefully you are ready to get started with this exercise program. So this is the second video, or exercise number 2, in the arthroscopic knee surgery program number 1. This exercise is called the quad set. So let me just show you what that looks like. So for the quad set, what you want to do is try and push the back of your knee down toward the couch or the bed that you are sitting on, or even the floor if you can get down to the floor. And when I do that, you'll see and feel that the quad, which is the muscle on top of your thigh, will tighten up. Some of you might also see and feel that your heel comes up off of the couch or the bed when you tighten that. Some of you will, some of you won't. Doesn't mean that you're doing it wrong. The main thing is that you try to push the back of that knee down toward the floor, the couch, or your bed. And then by doing that, you'll see and feel that muscle on top of your thigh, the quadricep, tighten up. All right, when you do this exercise, I want you to tighten that up, hold it for a count of 3, and then relax. Tighten it up again, hold it for a count of 3, and relax. Tighten, hold for a count of 3, and relax. And so on. Now, when you do this exercise, you're going to do lots of repetitions. So I want you to do 3 sets of 20 to 25 repetitions. This one's going to take you a little bit extra time just because you have to hold each repetition. Now, to start with, if this is day 1, day 2, or day 3 for you, to start with 20 to 25 repetitions might be a bit much, especially if you're tightening that as much as you possibly can. So just make sure that you're not overdoing it. You want to tighten that as much as you can comfortably. It should not cause typical knee pain. Shouldn't cause any sharp pain. So just make sure that you're doing that comfortably. And like all the exercises in this program, right now you're going to do this exercise for 3 to 4 times a day. If you can get this in even a 5th time during the day, that'd be great. Remember, in the beginning, your job is just this knee surgery and trying to get over this process, trying to get through this process. So it's that rest, ice, elevation, and exercise. And that's up to that 7-day mark. After that, you can go on to the next exercise program. So just make sure that you're getting these in often enough and view the rest of the videos in this exercise program.